The single most important thing you can do to ensure a more positive birth experience is to surround yourself with like-minded people who value your input, value your journey, value your preferences, who are going to support you no matter what your birth plan and preferences look like. So a few things to consider when choosing your birth team is, what kind of birth do you want to have? What does your birth vision look like? Do you know that you want to have pain medications, that you really don't want to feel the intense sensations of labor? You know that you're going to want an epidural. Then you're going to probably choose a hospital birth with more traditional OBGYN or hospital midwives. The other route would be an unmedicated birth, which you can do in a hospital, at home, or in a birth center if you have some near you. Something to consider is, in the hospital, it is very common to have medical interventions and medications. It is possible to have a low intervention birth, but you're going to have to work a little bit harder at it if that is your goal. So when choosing your birth team, that's the first step, to choose what your birth vision looks like. Unmedicated, medicated, where are you giving birth? Are you at home? Are you at a birth center? Are you in the hospital? Do you want to leave your home center to go to a different location in the midst of your labor? Do you want a traditional OBGYN? Or do you want a hospital midwife? Or do you want a home birth midwife? Do you want to have that unmedicated homey feel but be somewhere beside your home? Then a birth center might be good for you. The next thing to think about is hiring a doula. A lot of people don't see a doula as a necessary inclusion in their birth team, but as a doula myself and as a former labor and delivery nurse who has witnessed hundreds of births, I actually thought that I was okay to not have a doula for my birth. And my husband ended up being so exhausted emotionally, physically, and obviously they're going to be a part of it no matter what. But having that support for your birth partner as well is a huge factor. And as the laboring woman, you should not have to be in your logical brain. You should really be in your primal brain and not making a lot of decisions. You should have done all the prep work ahead of time so that when the moment comes, your birth team knows exactly what you want and you can just go. You can just not think about anything and just be in your primal brain ready to meet your baby. So having a doula is an amazing resource because they not only guide you through your entire pregnancy, birth, postpartum, breastfeeding experience and help to learn about newborn care, but they are really there during the labor to provide you that continuous support that a traditional provider is not going to be able to provide. So pretty much wherever you choose to give birth, the provider will be there primarily for medical purposes. They're not doing a lot of the emotional support because they're very busy. So it is not guaranteed that you will have them there for most of the hard parts of labor. In the hospital, a lot of the time your provider will be coming to check on you every few hours, sometimes even less frequently than that, and your nurse might have other patients as well, so they might not be in there as often as you would think. You are really left with your birth partner to do most of the laboring on your own. And the provider usually comes in at the very end of pushing to catch the baby. And with home births, they usually do provide a little bit more support during labor because they are in your home. So the midwife will be more present, but they still have all of the medical side to monitor. So they're not providing a lot of that emotional support. While they will provide some, and they're very holistic and family focused, and they do really care about their patients, they're not able to provide all of that emotional support because they're making sure that mom and baby are safe and providing all of the medical care. So while having a really solid birth team provider-wise is a huge factor, having a doula is amazing because they really truly provide that emotional support and also have a lot of tools for baby positioning, how to make labor progress naturally, how to work with your body, how your hormones work. They really guide you through all of that so you don't have to be thinking about it and you don't have to be doing a lot of exhausting mental work, and your birth partner feels supported too. So your birth partner doesn't feel like, oh my gosh, I forgot everything we learned. What am I supposed to be offering you? And also, if they need a break during labor, the doula can provide that for them. So why is choosing your birth team so incredibly important? It needs to be a good fit. You don't want to feel like you're fighting your birth team every step of the way to have the birth that you want to have. And even the pregnancy experience and the postpartum experience. That will mess with your psyche so much through this process. And that is, believe it or not, one of the most important parts of labor and delivery. Altered psyche in a negative way can really change your entire experience. We need to feel safe and supported during birth. And if we don't feel that, it can stall or even stop labor. We are animals, and as animals, we are given these instincts and hormones that protect us and our babies during the birthing process. So if we do not feel that safeness, that secure environment, we don't feel supported by our birth team, our body will actually prevent our baby from being born out of safety and out of necessity. So it is very important to have a trusted provider, a doula, a very supportive birth partner, to know that your birth partner is on board. Anybody who comes into your birthing space should fit the vibe you are going for. It is extremely important. So the first thing you want to do on this journey of having a better birth experience is to really think about what that looks like for you. So write down what kind of birth I want. Where do I want to give birth? Given those things, what are the best options for who will be there? Whether it's traditional OBGYN, hospital midwife, in-home midwife. Do some research on what's available to you in your area. The other option would be a midwife in a birthing center, and that might be connected to a hospital. So that's another option to look at. But really do some thinking on who you want in your space and how you want to feel, because those things are very connected. They go hand in hand, and you want to feel supported, safe, and secure during your birthing experience. Thank you so much for joining me, and I hope you subscribe and come back for the remainder of the 30 days to a better birth. Have a great day.